Hey, it's Tiffany, your favorite therapist. Why? Because I don't gatekeep. We are sharing all our information, resources so that you can succeed. Today, what we're going to do is we're going to practice a few questions that could be on your test. And so, I produce these questions based off of books and resources that I have studied. And yes, the answers are correct. Please don't play with me, okay? Okay, so this is how it's going to work. I am going to show you a slide with the question. Let it sit there for about 2 minutes, and then I'll show you another slide with the answer and explain how to choose a choice. Now, at the end of this, I have a chart for you. You can utilize or save if you need to, but here's a disclaimer. I am only here to help support you study, so I cannot guarantee that you will pass just by watching my video. However, I do have a previous video that talks about all the resources that I have used to pass my exam on the first attempt. Okay, I only took the test one time, and I'm hopeful that you can utilize those resources to make sure that you're taking that test only one time. And if this is your second or third go around, guess what? This is your last go around, okay? Because you're going to pass. The first step of passing is just telling yourself you got it. And guess what? You got it, okay? So let's go ahead and get started on studying. If you have any questions or concerns, please put them down in the chat. Now, I'm just going to ask one thing. Go ahead, subscribe, like, or comment because that is the only way that I can help you guys with these videos. I am a full-time therapist. I am a full-time mom. And guess what? Time is not free, okay? So help your girl out. Let's get started. A 32-year-old client presents with delusions, hallucinations, and disorganized speech. Symptoms has persisted for more than 6 months. A. Schizophrenia. B. Bipolar disorder. C. Major depressive disorder with psychotic features. Or D. Schizoaffective disorder. If you chose schizophrenia as the correct answer, you did a great job. Let me explain to you how to go about solving questions such as this one. The first step is one, you have to know the different diagnoses. And the way to help you study that, I will highly recommend is you create a system. For me, the system was looking at diagnoses that are quite similar to one another and figuring out what makes them different. And I just used a flashcard for this. So in this case, all of these symptoms, all of the diagnoses that are appearing do have some similarities. But you really have to pay attention to the duration. So, when we think about schizoaffective disorder versus schizophrenia, they look exactly the same when it comes to symptoms, except for the duration, okay? So, schizoaffective disorder takes place within with at least 2 weeks, whereas schizophrenia is 6 months. So, that's how you kind of do that elimination situation. Now, when you compare the disorders, so we already know D is out, it's not an option, okay? But then when you think about C, major depressive disorder with psychotic features, the thing about schizophrenia and schizoaffective disorder is that depression or any mood disorder is not prevalent as the first primary symptom. So if they are displaying depression or mania, etc., it wouldn't be the first thing you see. It wouldn't be heightened, right? So that's how you know that C is not the answer, because major depressive is the first symptom or the most heightened symptom. So that means that it cannot be that, because we're not even discussing anything about depression, okay? So you already know that C is not the answer. And then you think about bipolar. Bipolar goes from depression to manic, or manic to, right? So we just talked about that when the mood shifts. Again, mood was not discussed in this, so you automatically eliminate B, which leaves the option for A. A client reports intense fear of flying, leading to avoidance of travel, and experience panic attacks when thinking about flying. A. Generalized anxiety disorder. B. Specific phobia. C. Panic disorder. D. Agoraphobia. Generalized anxiety disorder. It typically happens all the time, and it happens, the person's just worried all the time about anything, any time of the day. Like, okay, worried today, worried tomorrow, worried next week. And the thing about anxiety is just about the future. So they're worried about things that's going to happen in the future, right? With this question, it specifically tells you when it takes place, right? So you can say to yourself, well, this is a panic disorder, because they say in there that the symptom is the panicking. But this is the thing about panic disorders. Panic disorders take place frequently, and you really can't assess when they're going to take place, because what happened with panic disorders is typically there's an environmental stress that the person is unaware of. So they have no control of knowing when it will happen. And so with this question, the answer already really tells you the question already told you the answer because it tells specifically when it occurs. So the only thing here that's specific could be B or D. But the thing about D is that D occurs typically when someone cannot escape from something. So you could say that D is the option here because typically if someone's on an airplane, then they won't have the ability to escape. But the thing about it is that because it's so focused on the fact that it's only one flying and they actually avoid flying because of that reason, that's why it's B. It's a specific phobia because that person avoids that specific thing and they're afraid of it, okay? So before we talk about the answer, let's talk about a really great way to look at this one. When we think about personality disorders, you have to know the difference when they exist, okay? You need to know what they are. So when you think about borderline personality disorder, what I like to think about is people who are like borderline, like literally when I think of the word borderline, like they don't know what's happening, so they kind of stay like on this fence. And so typically with borderline personality disorder, the person's afraid of abandonment, and so sometimes they do things to push people away from them. So I kind of just think of them like if I vision it, I think of like standing on a cliff and they're kind of like either pushing themselves over to the left or over to the right, and that's what helped me remember a lot about borderline because I see it visually. Now, when you think about antisocial personality, those are people who typically do not regard other people's feelings. They don't have empathy. And so that is very similar to narcissistic. But there is some differences there, and we're going to talk about it in a second. And then when you think about histrionic personality disorder, I just think of them as being like dramatic. And I know that sounds crazy, but when I hear that word, I just think of like drama, like them presenting themselves to be. Because when you think about like a historian, like if you remember like how your teacher was, like they were very dramatic when they were trying to explain to you about history. So just think about like dramatic and being like over the top. And so For this case, grandiosity could be viewed as that, but the difference is the need for admiration, which is not what's happening with the drama. So when it says need for admiration, that's where it differs between antisocial, because antisocial people do not care if you like them or not. They don't care. And so for that reason, you already know the answer is B. A 7-year-old child is brought home by their parents due to frequent temper tantrum outbursts and an inability to follow rules both at home and school. The child also has difficulty maintaining attention and completing tasks. A. Oppositional defiant disorder. B. Attention deficit hyperactivity disorder, ADHD. C. Conduct disorder. Or D. Disruptive mood dysregulation disorder. When you look at the options, they all have a ton of similarities. For example, like the onset of age is one, the fact that temper tantrums exist in all of them. But what really stands out is you have to pay attention to what's being said. So, what's being said is that temper tantrum outbursts exist, but there's also an inability to follow rules. So it says inability, not saying that the person chooses to do it, they're saying they don't have the ability to do it, and that's the difference. So when you think about opposition or defiant disorder, cognitive disorder, and disruptive mood, what happens in those is when you say, like, say, if you told a child, like, hey, go sit down, and they say, no, you go sit down, right? That's them choosing not to do it. Whereas a person who doesn't have the ability to do it, if you told that child, hey, go sit down, they'll probably sit down, but then they'll jump back up because they just forgot that they were supposed to be sitting down because they have an inability to follow the direction versus just like saying and defining what you're telling them to do. So that's how you know that B is the answer, not A, C, or D. A client reports persistent feelings of sadness, loss of interest in activity, weight changes, and insomnia for the past 2 years. A. Major depressive disorder. B. Persistent depressive disorder, also known as dysthymia. C. Bipolar 2 disorder. Or D. Psychothymic disorder. If you chose dysthymia, look at you. You got this. Okay, so for those of you who didn't choose that, let's talk about this a little bit. Now, all of these disorders that are presented to us have some symptoms of depression when you hear them. But listen, what's important is duration, okay? So when you think about C and D, uh, manic or hypermanic is involved, which was not mentioned here. So let's automatically knock those out. Boom, boom. We didn't talk about any fluctuation in mood, so those two do not belong here, okay? So now we have A and B. What makes A different from B is the duration, okay? B takes place within 2 years, okay? So it's B. But keep in mind, if this was a child that we were talking about, it wouldn't be 2 years, it would be at least a year, okay? So I just want to make that differentiation. And when you think about major depressive disorder, the difference with that is just that it only needs to last for at least 2 weeks, okay? So that's it. That's the big difference for that one. Here's a chart of the diagnosis that we discussed today. My goal is to make it downloadable for you guys. I'm gonna see if I can put it at the bottom of the link at the bottom. If not, just take a picture of what we have here. For any questions you have, go ahead, please leave it in the comment box. And all that I ask is that you subscribe and like this video if you would like for me to make more of these. Also, if you have questions or concerns, go ahead and put them in the chat box. I try my best to answer every single person because I understand how important and how stressful it is to prepare for this test. But I'm telling you guys, you can do it. You got it, okay?